So welcome to Integrated Health Association and the Functional Medicine Coaching Course Orientation. Before I begin, please read the disclaimer. I just want to draw your attention to the fact that this information cannot be construed as diagnosis or treatment in any way, and it's for informational purposes only. If you're a practitioner, we encourage collaboration with other practitioners, and if you're a patient, please make sure that any changes you make, you discuss with your medical practitioner. So why are we even considering a health coaching course? So you may be considering a health coaching course because you want to self-coach, because you want to address your own health, or because you want to have a look at your family's health and you need a grounding for your family's health benefit. Or you may want to add the aspect of global impact. In other words, use your information in its pure coaching capacity and start making an impact with the people around you, literally one person at a time. Now, the challenges in global health are really as following. There are lots of challenges, but basically, you're looking at about 4 in 5 adults that have at least 2 comorbidities, and 3 in 5 have got at least 3. We need to know that our genes are not the major contributor to disease. In fact, lifestyle is far more influential in terms of whether or not you're going to get a particular non-communicable disease and whether or not you're going to recover from that. And lifestyle changes affect all-cause mortality. In other words, they affect whether or not we are going to die of general causes. So, for example, the incidence of diabetes was reduced by more than half with a lifestyle intervention, but only a third with metformin. So metformin is the standard go-to treatment for people who've got diabetes, and that was compared to their placebo. Another example is lifestyle changes associated with improvement in sexual function in about 1/3 of obese men with erectile dysfunction. And anybody who suffers from erectile dysfunction will know that getting a successful treatment for it is not an easy path. Practitioners that we go to don't have the time to address lifestyle changes in a consultation. So consultations are quite short. So if you're a practitioner, very often you've got the best intentions with regard to your patients, but just not enough time to affect a lifestyle change. And if you're a patient going to a practitioner, very often what you're getting from that practitioner is really only 15 minutes or a short period of information and nowhere near enough information for you to make long-term lifestyle changes. So in South Africa, we have some additional challenges, but I think these challenges can be applied to many countries. First of all, we've had a brain drain from South Africa. So very highly qualified, experienced medical practitioners have left South Africa to go and work in different countries. So that means from the practitioner perspective, you are spread very thin, so you certainly don't have time to address lifestyle changes with a patient. But secondly, from the patient perspective, is for them to find a practitioner who can address their health problems from a more integrated or holistic approach is obviously much harder for them to do. Secondly, we have poor hospital quality. So our government hospitals have very, very poor quality. So the primary focus for us all is really to stay out of hospitals. Within the hospitals, there's very often indifferent nursing. In some cases, it's because the nurses are not well qualified or not experienced or not well paid. And that's another issue that increases the hospital experience for the patient in terms of it being an unpleasant or substandard experience. Now I have done a lecture on national health. So if you have a look, there are slides and there is an example of that lecture which goes through trying to avoid going into hospitals altogether. Also, medical aid funds are limited. So even if you have got the wherewithal to go into a private hospital, medical aid funds might be limited. And COVID has actually shown us that in a very small space of time, getting into a hospital and being treated properly in a hospital is an uncertainty. So managing our health and creating a situation where we are optimal in terms of our health, it behooves us to do that, because I think we have to take control now over our own health. And if we are in a position where we can start guiding other people to take a holistic and more integrated approach over their own health and take control over their own health, it's going to benefit our situation quite substantially. So when we suffer from a particular disease, very often we become blinkered and very linear in our approach about that disease. We forget that diseases are not linear, and very often our susceptibility to disease, how well we recover from that disease, and how we feel while we are struggling with that particular disease is affected by many variables. So, for example, the disease root causes might be what and when we eat, how much we eat, whether we're breathing pure air or drinking clean water, soil health and the microorganisms that live on us and in us. And that is a whole science on its own. And they're finding that our microbiome influences our susceptibility to disease. How much exercise we do and what kind, physical and mental trauma, as well as psychosocial factors. So, for example, what's happening in our family, our work, and our stress levels. And stress has now been recognized as a contributing factor in certainly non-communicable diseases. So our exposure to chemicals, including pharmaceuticals, many people, especially as people get older, they're taking 5, 10, 15 different pharmaceuticals. All of these pharmaceuticals have their own side effects and their own response in the body, and all of these pharmaceuticals need to be cleared and metabolized by the liver, which increases the toxin load. And of course, exposure to radiation is something that we don't think about at all. So just understanding that if we have non-communicable diseases, and we want to mitigate our risks or recover from them, just taking the silver bullet, which is what I call the silver bullet, but basically thinking that a pill is going to solve our problems is very short-sighted when we consider that there are so many factors that feed into how our body responds to a disease and how our body responds to toxins. So really the purpose of a course like this one is to give you an overview of the factors that feed into disease, and more importantly, to give you tools that you can either use yourself or give to your patient that are all already made to save you time, so the patient still gets the information they need about how to change their lifestyle, but you as the practitioner don't have to spend an hour with that patient to give them the tools, or you as the patient have ready-mades that you can start implementing in your life to make the changes you need to your health. Now, in what way does functional medicine address disease, particularly non-communicable diseases, that is different from the present approach with the standard care and the standard medical model? So functional medicine looks at the interconnectedness with every single system. So, for example, it looks at intracellular communication and communication with the outside of our body. So in this way, functional medicine addresses the health of our hormones, and it addresses the health of the messenger cytokines. So those would be the inflammatory cytokines in creating this either intracellular communication or communication with the outside of our body. Functional medicine looks at metabolism and bioenergetics. So it doesn't just look at digestion of food. So for example, if you're looking at a traditional medical model, if you've got gut problems, the traditional medical model will look at just dealing with the gut problems. Functional medicine will address gut problems, certainly, so it addresses the digestion of food, but it also looks at that conversion of food into energy within the mitochondria. So, for example, if you've got poor mitochondrial health, you may be eating food, the food may be effectively being broken down by the stomach acids, but it's not able to be used in the mitochondria, so the energy output is inadequate. And if the energy output is inadequate, then the body can't heal properly. Functional medicine also addresses waste elimination, and in this way it looks at the integrity of the gut and, of course, all the gut microbes that make a difference to our health. It looks at defense, so defense of our body, in other words, our immune response and our inflammatory status, protection from bacteria, parasites, and viruses. Now, traditional medical model will wait until we are infected by bacteria or parasites and then address the infection. Functional medicine looks at bacteria and parasites from, number one, from a preventative perspective, but also from the perspective of the health of certain bacteria. So again, if we look at the gut, the microbiome, where bacteria is really, really important, functional medicine will acknowledge the fact that bacteria is important. Just going on antibiotics may resolve one particular bacterial overgrowth, but it also trashes all the other bacteria that may influence what genes are expressed or not, for example. It looks at structural repair and maintenance, so what's going on with the cell membranes. So in other words, cell membranes need to be firm but fluid structures. If you don't take in the required nutrients, or you have certain gene SNPs that affect the integrity of the cell membrane, then the receptor sites, so for example, the insulin receptor sites, will be suboptimal as well, because the structural membrane of the cell membrane is suboptimal. I mean, I'm just giving you examples on small ways that functional medicine looks at all of the factors that feed in. It addresses transport and circulation, and this is important for moving hormones around the body, moving enzymes around the body, and of course inflammatory cytokines. So that's the blood supply and the lymphatic supply. So if we had a look at an overview of traditional versus functional, the traditional approach, when you have a series of symptoms, traditional approach looks at those symptoms and names the symptoms or the disease, so it'll give a name to it. The diagnosis is based on a list of symptoms. So for example, if you have joint pain, your diagnosis will be either rheumatoid or osteoarthritis. But what is not addressed in the traditional approach is why did the patient get rheumatoid arthritis in the first place. So the symptoms are treated, and very often very effectively, from the perspective of various pharmaceuticals, but the reason the patient got that problem in the first place is not looked at. So very little attention is given to root cause, and no why questions are asked. The other thing is the degree to which you are suffering from a particular condition is measured against population standards, and each system or each organ is looked from a separatist perspective. So you'll have a specialist, you have a pulmonologist, you'll have an endocrinologist, you have a cardiologist. So all of these will look at their particular system separate from the rest of the body. And the treatment focuses on symptom relief rather than undoing what was the original cause. And basically, it's what drug is going to be the most effective in offering symptom relief. Functional approach looks at the root cause. In other words, why has this patient, or why have you got a particular condition? It looks at the individual's baseline. In other words, what are your hormones doing? What are your cytokines doing? What are your genes doing? So it looks at the body as a whole. In other words, inflammation. So for example, if you have chronic inflammation, let's say rheumatoid arthritis, not only affects the inflammation of the joints, but also increases the risk of developing heart condition, which is also inflammatory, or cancer, for example, which is the base of these conditions are inflammatory in nature. It looks at what imbalance led to the symptoms. So, for example, I mentioned perhaps low energy. So the mitochondria that are the energy factories in the body, they require certain nutrients to function properly. If a patient has poor digestion and they're not absorbing the nutrients, then the mitochondria may be suboptimal, and then the energy output is suboptimal, and then the patient cannot heal if they've got other conditions. So functional approach addresses the imbalance and not the symptom. So if you look at the future of healthcare, because the future of healthcare is moving in great strides, the functional medicine approach dovetails very well with the future of healthcare, especially if you work on a more holistic view with the present medical model, the future of healthcare, and adding a functional medicine approach. So when you're looking at the future of healthcare, you're looking at personalized healthcare, where the patient is looked at as an individual, where their inherited gene SNPs play a role, their nutrient status plays a role. any sports susceptibility, what is their stress impact and how is that influencing their chronic diseases, their risk of heart disease, for example, any cellular damage, their risks of cancer, for example. It looks at the epigenetics, which these are inherited. So, for example, depending on what our parents or grandparents, how they lived their lives, it influences how susceptible we are to disease. It looks at issues such as food phytochemicals. These are signaling molecules. They affect how our genes are expressed. In fact, more than 70% of chronic disease is related to lifestyle and epigenetic factors. So epigenetic factors look at the influence our lifestyle has on the expression of our genes. So instead of just treating a symptom, and that's important too, because we all know that when we are feeling unwell or there's a problem, we can't wait for the changes, the nutrient status to change whether our genes are being expressed. We need to address that symptom now, but we need to do the two concurrently. And chronic disease is a result of this interaction between our inherited genes and our environment, so in our lifestyle. In other words, what are we doing with our particular gene SNPs? So functional medicine looks at that interplay between your inherited genes, your lifestyle, the foods that you are eating that you shouldn't be, the foods that you're not eating that you should be. What are your stress levels? What are you doing with regard to exercise? What are your sort of psychosocial levels? And how all of these feed into increased risks of chronic diseases. And when you've got inheritable increased risks, how can you make sure that even though your parents, your mother or your father has got Alzheimer's, for example, that you're not actually going to develop it? So the aim of this course, and in fact any functional medicine or integrated medicine course, is really to teach the practitioner the functional approach to health compared with the more traditional approach, the partisan approach to health. So whether you are a practitioner or whether you are an individual wanting to improve your health, the aim of this course is to show you a slightly different, more integrated approach. So what we do in this course is we illustrate the interconnectedness of all the body's systems and how the systems impact on the health of other systems. So, for example, if any one of the systems have broken down, let's say, for example, the mitochondria or the energy system, this impacts on all the other systems, because if the body, energy, of course, and mitochondrial health and the production of ATP is really the bedrock of life. So if the mitochondria are damaged in any way or suboptimal in any way, then it's not only going to affect the direct linear approach to energy, but it's also going to affect how the body heals, for example, because we need energy to heal. So, that's just one example. So we also illustrate that the system by system common conditions. So in each system, what we've done in this course is that we've gone through the common conditions that could go wrong in each particular system and how they relate, if they do, to any of the other systems. We look at optimal versus average lab values. So average lab values occur because the laboratories will work on what is, in terms of their tests, what are the common values that come out. So if they look at the population as a whole who have that test, what are the average values? But the problem with that is that as certain populations become more and more unwell, those lab values get skewed because those lab values are just what is reflected in the population, albeit an unwell population, and not optimal values. So in this course, we will look at optimal values versus the average lab values. Of course, how to return the body to a healthy equilibrium. But specifically what we've done in this course is that we've provided done-for-you tools. So if you're a practitioner, we acknowledge that one of the biggest problems is you spread very thin on the ground, and teaching a patient life lifestyle changes takes time. So what we've done is we've done that for you. We've created all the tools for you. So once you have made your diagnosis, decided on your treatment, and then are wanting to add support documents to your treatment so that your patient has the functional approach as well and the lifestyle changes, you can actually just give the document to the patient, and we have created all those documents for you. Similarly, if you are a patient and you're wanting the step-by-step approach on how you go about making certain changes, we will give you those documents. And of course, this approach saves explanation time so that you don't have to sit, if you're a practitioner, with the patient and go through each step. And it keeps your consultation short, and it gives the patient a practical roadmap so that they know, I must do this, then I must do this, then I must do this. So the integrated health goals, our goals are to create a program that is a prevention-focused healthcare program. Although addressing the problem is important, so when you're coming at addressing the problem from various treatment approaches, whether they be allopathic treatment approaches or whether they be any pharmaceuticals or homeopathic or nutraceuticals, what one primarily wants to do is also create a situation where you're preventing problems. The other thing that we do is that we look at personalized treatment approach. So we take into account that every single person has different variables that feed into their health state. And it's a combination of their genes, their lifestyle, what they eat that they shouldn't eat, what they don't eat that they should eat, their stress levels, their exercise, their social situation, and all of those impact on any conditions that they happen to be suffering from now, but also their risk of chronic diseases. So we address those. What is important to bear in mind is that Integrated Health Association and functional medicine is a patient-practitioner collaboration. It is not a situation where the practitioner makes all the decisions and just tells the patient, right, you're going to take a pill for this and you're going to do X, Y, Z. It's important for the practitioner to guide the patient, show the patient what he needs to do, but the patient then obviously has to go out there with the information that he or she's been given, and do what needs to be done. So there's complete patient involvement and patient empowerment in this approach. It's integrative and a holistic wellness practice, so it looks at health and the body as a whole. And we look at improvement of patient outcomes. So it's not enough to just have the silver bullet approach, just give the patient a pill that masks the symptom. We want to develop the root cause, find out what are the triggers, find out what variables are exacerbating the root cause, and address all of those to improve the patient outcome. Taking control over our own health reduces health costs, and very often what one needs is supportive assistance, so we just know in what direction to go, what steps do I need to take, what if something goes wrong, who can I talk to about this? And this would be our goals as Integrated Health Association with this particular program. So the course offers completely online learning, and because it's completely online learning, it has allowed us to keep the price of the cost more affordable. So it's comprehensive, integrated, and holistic information. It is science-based. So when treatment suggestions are made, they are linked to the PubMeds, to studies in PubMed. So everything in the course can be cross-checked, and probably the best repository for studies is PubMed. So functional medicine as a whole is science-based, and this course is connected to what studies have been done. The cost is affordable. So affordable as an addition or an adjunct to your existing medical practice. Also cost-effective for someone who wants to take over the coaching aspect and support other people, but also people who just want to make changes for themselves in order to mitigate medical costs as time goes on for them. There are supporting lectures in every module, so there are 14 modules, and each module has supporting lectures, plus each module has a course book, so course notes, and of course there are studies that are references in each module. So it's personalized and patient-centric, and what it really offers is time-saving patient care. And the way we've done this is to create the done-for-you patient resources. Our approach is a root cause approach. In other words, what is causing the problem and why is this problem occurring? Not simply what can we do to what I call band-aid the problem. What can we do to mask the symptoms? Our goal is reduced healthcare and reduced healthcare costs. Our goal is improved outcomes by looking at all the variables and not just a linear approach. We have addressed in the course how to set up a business using social media, because many people may have a very thriving practice, but they don't have the business aspect, and the world is moving into social media and social media connections, and we address that, how to set up your website, for example, how to link with Pinterest and Instagram. And then, of course, the done-for-you marketing tools really will make the difference, not only for your own journey, but for the journey of any patient or any client that you happen to be working with. So if you have a look at other excellent functional medicine schools and their comparative costs, the Academy of Integrated Health and Medicine, their cost, now the costs generally come in as dollars, so I've just converted them to rands, but their course is $364,000. Functional Diagnostic Nutrition, 126,000 Rand. Functional Medicine University, this is also an online one, 38,000 Rand. So this is the next most reasonable one. Institute of Functional Medicine, this is really the gold standard of functional medicine courses. It's 230,000 Rand for all the modules. Functional Medicine Coaching Academy, 137,000. The Kalish Institute, that's got a more business focus, 207,000. And then Integrated Health Association, which is this particular course, is an online course and it's 12,000. Now, the reason that we've brought the cost of this course down so dramatically when you compare it to others is partly because it's a mini overview, but secondly, because we want it to be a community project. We want to reach as many practitioners as we possibly can, and this includes practitioners such as nurse practitioners that may be in small rural areas that want to add to the community with their knowledge. So because of that, we've made the course which contains the information that you can practically use as a functional medicine practitioner, but we've made it more cost effective to increase our reach. So who will benefit from this course? So medical practitioners, medical specialists, biokineticists, podiatrists, physiotherapists, psychologists, personal trainers, chiropractors, homeopaths, registered nurses, sport coaches, massage therapists, all of these people who have practices either directly within the health industry or on the fringes of health industry will benefit from this course. Now, the plan of action is, obviously we ask ourselves the question, how can functional medicine improve my practice? The way to do it is to review the introduction and the startup booklet. These are obviously free for anybody to just have a look at. Set up the website and start blogging immediately. If you don't already have a website, go through the process of learning how to set up your website and start blogging. The reason for this is that it takes a long time to gain a foothold in the social media world. So even though you may not have completed the course, and that may take you time, we can always find good articles to blog so that you can start promoting your website. You want to begin your business exposure, collect email addresses from existing clients, ask clients would they like to receive your newsletter, and then you're going to start sending out your newsletter. And we do show you how to go about doing that, how to create a newsletter and how to send it out. Obviously, complete all modules, and there are 14 modules. So also just to give you an overview, in each module there are approximately 2 lectures, sometimes more, and the lectures are about an hour long each. There's a course module book, and the course module book is between 25 and 35 pages, and then of course there are studies that are associated with that particular module. You want to complete the multiple choice exam of 100 questions, and you will need to pass that with 80%. And then the best approach is to set up a short community or YouTube lecture. I've actually created some for you in the Done For You resources. So, for example, lectures like Sugar in My Child, or lectures on intermittent fasting, or functional medicine and weight issues, or pain management. Each of these, if you set up free community lectures with each of these, and they are done for you, that will create a situation where people will be able to see, right, here is a person who can help me with my health, and you will then become more in the forefront of people's minds in whatever community you happen to be. So if you're a medical practitioner, it may serve you better to put one of your staff members on this course, and then your staff member is the support for your patients when you diagnose and you're treating your patients from your perspective. That might work, that might serve your practice better. Now, I would definitely recommend, before you make the decision, yes, I'm definitely going to do this course or any of the other courses, is that you go and you have a look at the free lecture on pain and inflammation, because that will give you an idea about how the functional medicine approach addresses pain and inflammation. Because most of us as practitioners, patients come to us, and we, regardless of what our practice specialty is, almost invariably we have to deal with issues that involve pain and inflammation. And very often we treat it literally just from either a biomechanical aspect or from a painkiller aspect or a non-steroidal anti-inflammatory aspect. We don't address it from the multi-layered functional medicine aspect. And doing that lecture, watching that lecture, will give you an idea. This is how functional medicine addresses an issue that most of us as practitioners are exposed to. Just to give you a snapshot view of the course overview, your booklet on how to start up will give you sort of an initial step-by-step. I give you a symptom tracker sheet. So what the symptom tracker sheet is, if, for example, you have a client or you yourself struggle with various symptoms that don't seem to show any kind of a linear path, the symptom tracker sheet will give you an overview of all the conditions that come in that could be associated, for example, with gluten sensitivity or histamine intolerance, all these more obscure type conditions, and what the primary symptoms are for the more obscure ones and, of course, the more common ones. There are about 150 resources offered, and these would be resources that you would offer your client, or if you are the patient, that you might use yourself. And these resources take the form of booklets, foods to eat, charts, all of those done for you documents that will help you in your journey or help your client in their journey. The course consists of 16 modules. It's 14 modules, but resource modules as well. The module textbook, which is 260 pages, but each module in actual fact is broken up into its own textbook, but there is a complete textbook as well, which is 260 pages. And the module lectures, and there are over 90 module lectures. So how do you set up your business? You have a look at the business startup document. You set up your website, Instagram, Facebook, Twitter, and we have given you marketing ideas. In terms of supporting your clients, so what exactly are the modules that we cover? We look at gut and gut-associated symptoms, and that's all gut-associated symptoms. Weight loss and insulin resistance, so metabolic problems and sugar dysregulation. Inflammatory conditions, so how to quench inflammation. And bear in mind that inflammation is a foundation for, I would say, pretty much all the non-communicable diseases. So that includes heart attack, stroke, cancer, osteoporosis. These are all grounded in inflammation. Energy synthesis, I've alluded to energy problems associated with the mitochondria, brain health, Alzheimer's, and in fact Parkinson's as well, healthy thyroid function, hormones, mood, and stress. Other common health challenges that are very common but often missed, so migraines, alcoholism, histamine intolerance, and candida infection, cancer considerations, detox and household toxins, genetics and methylation, laboratory and diagnostic tests, and then of course we put it all together. The resource support. So Integrated Health Association gives you all the resources that you need. You looked at the detailed system by system functional care. So for example, pain management, I've spoken to you about that. We look at how to establish the root cause. We look at establishing what are the exacerbating factors and measuring the labs for optimal evaluation. We look at all of those variables. So we establish the link up, the association with all of those variables, decide on a support plan that addresses all of those variables. So you might find there might be 3 or 4 support plans that a patient or a client might need, and then you may decide to start with 1 or 2 and slowly feed it to them, or do all the support plans at once for maximum benefit. And then what you do is you give the client the resources so you can facilitate their compliance and make it as easy as possible for them to follow what your suggestions are. So please feel free to contact me. My contact details. You can email me on health@liveto100.co.za or have a look at integratedhealthassociation.com. Please let me know your thoughts. I would love to hear from you.